Here we go.
Okay.
Good morning, everyone. Thank you so much for joining into our webinar today, Tuesday, June 20th. Can you even believe the time this year is flying by? So we're really thrilled to have all of you attend this webinar. Believe it or not, individual and family dental and vision is something that we get asked about all the time. And, for those of you that are in the individual markets, there are options within Penny, or Pennsylvania Insurance Exchange, that you can purchase dental separate from your health plan. But of course, the challenge is it's always tied to your health plan enrollment. Off Penny, there are standalone programs, Medicare, outside of the MAPD, there are standalone programs. But I think this product with Ameritas for the dental and vision, kind of really packages it very nicely. The ease of enrollment is out of this world, rating, etc. So I think it's a very good product for everyone that had any interest, that registered for this webinar, to really take a hold of and look at. We can talk commissions if you'd like, and there are the highest commissions in the industry. So again, dental and vision, something that you can add to your portfolio, whether you're doing the under 65 or Medicare, and continue to have your clients be happy. So Chad Canese is with us. He's the Regional Managing Director for Ameritas, and he's going to take us through the program today. There will be slides. The presentation is recorded, and each of you that registered, even if you can't attend, if you're not attending, you will be getting a link to the webinar. So there's no reason to take copious notes and go nuts. Just enjoy the presentation, and you'll get the documentation and resources after as well. As far as questions, if you want to type in questions in the Q&A, we can answer those at the end of the presentation. So for now, let's just sit back, and I'm going to hand the presentation over to Chad, and he's going to train us all on the benefits of Ameritas Dental and Vision. Chad, the floor is yours. Thanks so much for joining in.
All right. Well, you bet. Thank you, Deb. I appreciate it. And thanks to everyone at URL, and thanks for everyone attending. Appreciate being here. So with that, today I do want to introduce you to not just Ameritas, but dental and vision, the benefits, including it to your conversations, offering it to your clients. And we'll walk specifically through the product portfolio, some of the tools available to you, and then, as Deb mentioned, give you a real look at that ease of enrollment process that we're pretty proud of. So with all that, I'll go ahead and hopefully advance. Apologize for some of my lighting, by the way, to everyone out there that sees me on camera. I'm traveling a bit unexpectedly, so working from a hotel room, and I hope, Deb, my audio and camera are both working okay for you. So you all good? Hear me okay?
All good.
Okay, great. All right. Thank you again, everyone. There is the Ameritas headquarters. Everyone probably sees there on your screen. We're based in Lincoln, Nebraska. So if you're not familiar with Ameritas, we're a mutual company. We're A-rated with AM Best, A+, S&P. Ameritas has been around since the late 1800s, so quite a bit of history, and we do operate in multiple markets. But I think if you were to twist our arm, we really do consider ourselves a dental and vision company. So this is what we do. This is what we specialize in. So again, today we'll talk about why dental, why Ameritas, our PrimeStar products, and those support tools. Down at the bottom of this slide here, you've got my contact information. That's my mobile phone as well as my email address. So please keep that handy. If any questions come up for you at any time, feel free to call me, text me, whatever it is I can do, and however I can try and support you. And of course, my email address there as well. So I'll wrap up and bring this up for you at the end as well, whenever we run into some of the Q&A. Now, Deb, I think you mentioned it, but we do hear a lot more about dental and vision coming from clients. Hey, do you offer it? Do you have it? Can I get it? How do I get it? And I think there's a handful of reasons for it. One, we have a pretty significant group side, and we hear it and kind of see it, right? Some groups are limiting maybe benefits that they offer employees, pushing them into the individual market. A lot of people have, been laid off and remain laid off through COVID. They're searching for those individual benefits, but even on top of that, a lot more people are in kind of the gig employment, the part-time workers, and they don't have maybe traditional benefits. So they're in need of, they want, and they've got to have, or they realize the importance of dental and vision. It is one of the most commonly requested benefits. So important that you are talking to your clients about it, because as we say, if you don't, somebody else will. And I think this is where you have an opportunity not just to talk to your senior clients that might be looking for it as a kind of Medicare alternative, but even those younger clients that lack benefits and need and want dental as well. In fact, 64.4% of people out there work for an employer that doesn't offer them health benefits. A lot of 26-year-olds are aging off of maybe parents' plans, and they need coverage themselves. And again, we just see it and hear it time and time again, the need for dental and vision across the market as it relates to a client's overall health. Now, at Ameritas, and we'll circle back to some of those and just the importance and different demographics, but at Ameritas, we have been offering dental since 1959. The good thing, we do offer plans in all 50 states. So no matter where you might market, no matter where your clients might move to, we have product approved for them. And it is standalone dental and vision. So we don't tie it to anything else. We're not a Medicare provider with a dental option. We are standalone dental and vision. So you can purchase just dental, you can purchase just vision, or you can kind of wrap the two up together. The other great thing, you can sell at any time of the year. So you can go back and visit clients that you've talked with in the past. Hey, do you need or do you want dental and vision? Or even lead with dental and vision, as we see so many people do. And it's going to open new doors to you, new clients, to be able to go back in and cross-sell your other product lines. It's all guaranteed issue, and it takes just minutes to enroll for coverage that can start as soon as next day. Now, Ameritas, we have established, being around and doing dental since 1959, a pretty sizable network. In fact, if you measure us by access points, we're one of the nation's largest networks at around 582,000. We have 131,000 providers, and that's probably the more important figure. That's the actual number of dentists. And I think that total figure across, the country is around maybe 200,000 or so. Again, significant amount sits right there and participates inside of the Ameritas network. And we have 98% provider persistency. So once providers come into our network, it's pretty rare that they leave. That's a big benefit for your clients, reassurance that they go back year after year and their dentist is still participating or in the Ameritas network. If it applies, we do have providers all across the US and even now in Mexico. And what network means, more savings for your client. It's just a better overall experience as far as maybe some of the claims processing, no balance billing, anything like that. But in addition, savings. It's usually anywhere from 25 to 50% savings whenever your client elects a network provider. Similar with our vision, we do have two major networks. We'll look at those, VSP as well as IMED. But with all of our products, vision and dental, your clients can choose to go in or out of network. It's their choice, just better value when they choose network provider. So what we mean by that, and I think this piece does the best illustration of it. So today, and by the way, this piece is available on our website, as a number of them are, but even this one, you can go in and you can personalize it. You can drop your contact information on it. You can print it, share it with the client, as a number of our consumer pieces. So I'll point that out, and we'll show you where you can look for it and find it on the agent marketing site. But this example tells us about a client walks into a dentist today, and they know they've got an issue because that's when most people want to or realize they need to go to a dentist, right? This client finds out they need a crown, And a crown is one of our more common claims. And a crown in most areas can cost as much as $1,300. I think right there it says $1,368. So significant. Sticker shock. I walk out of the dentist's office. I'm not happy. That's a lot of money to spend. I talked to Deb this evening and I say, hey, do you have any options for dental insurance? And introduces me to Ameritas. I sign up and I enroll that evening for coverage that starts tomorrow, which again, we can do. I go back into that same dentist office tomorrow who happens to participate and sit inside of the Ameritas network. And the cost of that crown goes from $1,368 down to $803. That's just part of that network value that we're talking about, that savings of 25 to 50%. It's the negotiated rate that that network provider has agreed to for the cost of a crown. So before we even look at the insurance, significant savings for your client. Now let's look at the insurance. So I jump back here and I look to the PrimeStar Total, which is a product we'll look at here in just a second. It covers majors. It covers it at 20% day one. So that means now with the insurance included, I'm down to around $600 as far as my out-of-pocket cost. The co-insurance goes up in year two. It'll go all the way up to 50%. So cost out-of-pocket for the client, $402. So that's significant savings. That's real money, and that's a real life example. So again, just the value of the network itself, in addition to the coverage and insurance. Now at Ameritas, we're really excited to be able to share and let you know about that. Now on all of the PrimeStar products, 3 of them that we're going to talk about here today, they offer credit for prior coverage. And this is now also in most all states. In fact, there are only 3 states that do not offer credit for prior coverage: Washington, New York, and New Mexico. So everywhere else, if your client is replacing a fully insured policy from another carrier, whether it's group or individual, and there's not been more than a 60-day gap in coverage from one plan to the next, we'll jump them right into the year 2 coinsurance. So back to that crown as an example, that means 50% on majors day one, and we're covering, or the client's paying, only $402 on that crown as an example. So credit for prior coverage now available on all the PrimeStar products. Really great benefit, really easy to qualify for. You'll see how you do that during the enrollment process. You don't need to send us anything. You just enter in those details right there during kind of your checkout, if you will. The current carrier, a termination date, if any, and the policy number. That's it. Grab us that information. We put your client right into those year 2 benefits. Now, Ameritas was recently rated the best dental insurance for seniors in 2023. That's per Forbes Advisor. We're real excited about that, and hopefully you're real excited to offer it. Now, that's for seniors. We do have kind of a senior plan, so to speak, but in a separate survey, Ameritas was also rated one of the best insurance carriers for dental, regardless of age. So that is, again, something to remember. All of our products are available to anyone 18 and older. There is no max issue age on it. Of course, we can include dependents if they're under 18, but if you're going to be a policy holder, you have to be 18 or above. And you can choose any one of these plans that we're going to talk about. However, each plan was kind of designed with a different client in mind. And this one, while anybody 18 and above can purchase it, we kind of consider it our senior plan. Probably see here as we go through it, but it's called PrimeStar Total. And first off, it starts out with a richer maximum benefit. This one, it's $2,000 day one. That's per person, it's per benefit year. And then it jumps up to $2,500 in year 2 of the policy. All of our plans, everything that we're going to talk about here today, includes a feature called Preventive Plus. This is important to note. Preventive Plus means none of your client's preventive care counts towards that maximum benefit. So your client goes in for those preventive services. You see them there, those type 1s, exams, cleanings, bite wing x-rays. All of that is covered at 100%. You can see there as far as the coinsurance, but none of it will count towards that $2,000 max. We reserve that maximum for the larger expense items, those basic and major services. So a really nice benefit, and in a way kind of boosts up and bumps that maximum for your client. So Preventive Plus, keep it in mind. Deductible here, it's nothing on your preventive services. It's $50 per person per benefit year on basic and major services. Those preventives, they're covered at 100%. Your basic services, really rich coinsurance here. We start at 80, we go up to 90% in year 2. And then those majors, this includes things like root canals, probably are more common, the crowns, bridges, dentures, and yes, implants. We'll cover implants. We'll cover it as much as 20% day 1. And then we jump that up to 50% in year 2 of the policy. Now, remember, if credit for prior coverage, and I think where this can really be important, right? Your senior clients may be coming off of that group, they're retiring. You can jump them right into the 190, 50 benefits based on prior coverage. This one, again, with maybe more of that senior client in mind, it does have a hearing exam benefit. We'll reimburse up to $75 a year for a hearing exam. And if they need hearing aids, $200, $300, or $400 per ear, depending upon when they elect the benefit. You can elect it immediately. There's no waiting period, and none of that hearing aid benefit applies towards the maximum benefit. It's separate. It's just a straight reimbursement. So no matter where they purchase it, again, we're going to cover cost of hearing aid up to those amounts. Now, PrimeStar Access is kind of the second of the 3 policies. And this one here, I guess we kind of consider it more of our family plan. A little bit lower on that first year max, it's $1,000, and then up to $2,000 in year 2. Once again, includes Preventive Plus, meaning none of the client's preventive care counts towards the maximums. Same thing on the deductible, 0 and then 50 on your types 2 and 3. This one's going to look a little bit different here. So I mentioned it, and still the case. You can go in or out of network on any of our policies. However, with this PrimeStar Access, you see there that if a client goes out of network, the coinsurance does reduce. So more incentive to try and stay in and find a network provider when you can. If you go out of network on this one, it's 80% on preventive, but 100% there in network. The basic services, 65 up to 80. And then those majors, 20 and then 50, similar to our total plan, but 10 and 30 if you're going out of network. Similar features here on the majors, it's crowns, it's bridgers, dentures, and once again, yes, implants. We did also include teeth whitening. Kind of felt this maybe applied more to a younger demographic, I guess. And interestingly enough, Ameritas has some 11 million policyholders. I think this is one of our more commonly requested benefits from clients. So we included it here on the Access plan. Also making this a little bit more maybe family kind of plan, we included orthodontia. We'll cover 15% of that first year, up to 50% with the lifetime max for anyone under age 19. And then similar to that hearing benefit, this is just a straight reimbursement for LASIK. Your client wants LASIK, we're going to give them $125 per eye in the first 2 years of the policy, $250 per eye after the second. Just straight reimbursement, doesn't apply towards those dental maximums. Now, third and final plan, it's called PrimeStar Value. With this one, you can see it's a little bit dulled down as far as benefit, but that's intentional, just to get to a lower price point. So this is the least expensive of the plans, which you'll see here in a second. Usually runs probably $18, $19, maybe $20. The benefit, it's $750, and it stays there. Does have, again, that Preventive Plus feature. So maybe this is aimed at clients more looking for just real basic preventive care at a pretty inexpensive option. Or where you might also see it, where we've seen it, people that want standalone dental to add to existing coverage that they have. On any of our PrimeStar plans, we do not coordinate benefit. So what does that mean? We treat everything as a primary claim. So while clients might have some coverage, and maybe they have some coverage on another plan. It's supplemental benefit or it's an additional benefit, but they want something else. They need something else. They can purchase this, whatever is submitted to us. Again, we treat as a primary claim, no coordination of benefits. So that makes it valuable, but also the fact that it's standalone dental. Maybe you've got clients with other dental coverage, but things can change, right? They move plans one year to the next, that dental benefit disappears. Here's a chance to kind of have a standalone, travels with you dental insurance plan at a really affordable cost. And you can see it here, 90 up to 100 on preventive, 50 up to 80 on those basics. And then majors, it is the one and only plan where there is a waiting period. So there is a waiting period inside of the first year. Year two, it goes right to 15%. The other thing to note, it does not cover those implants. So you've got a client, you probably already get this, know it, but somebody that needs major work, needs it soon, you want to lean towards one of those other two policies, right? Either PrimeStar Total or Access. No waiting period on major, larger maximums. This one here, you do have a waiting period, and then we'll pick it up in 15% in year two of the policy. However, another area where this one's kind of stepping in, 180.15 if you do qualify for credit for prior coverage, and again, at affordable pricing. So that's one area where you might look to it, or maybe some of those younger clients that are looking more just for kind of preventive and basic care, with occasional issues that might pop up, as they often do in dental. So 3 different plans, 3 different areas as far as coverage for your clients and price points that go along with it. So shift gears here just for a second on vision. Now, we do offer vision as a standalone option. You can sell just dental, you can sell just vision, or you can bundle them up together. Similar to our dental, there's no waiting period, and we do offer those 2 nationwide networks. In fact, it's the biggest difference in the 2 vision plans. There's PrimeStar Choice, which our network here is VSP. And that might be kind of how you distinguish or choose the plan, right? Like if you're talking to your client, you might just ask, where do you go for your current vision care? Most clients are seeing someone, each and every year for their exam, their glasses, their contacts, wherever. If they see a VSP provider, you might lean towards the PrimeStar Choice. Some of those common providers include Costco, VisionWorks, Walmart, Sam's Club, Iconic. Those are just naming a few. You can see here some of the in and out of network benefits. The exam is every 12 months. The eyeglass contacts, the lenses and or frames are every 12 months. And you can see here too, the lenses, they're covered in full. The frames and or those contacts, it's up to $150. With this plan, you're usually going to be looking at about $16 per person. The other plan is going to be PrimeStar Select. And with this one, different provider. It's going to be iMed. Some iMed's notables include LensCrafters, Optical, Pearl Vision. A little bit of differences here on the plan. It's every 12 months, but every 24 for those frames or the lenses and contacts. So if you've got a client that likes to get glasses every year, maybe you encourage them to go to the PrimeStar Choice. But with this one, it's a $130 allowance for those frames and or contacts, but also a little bit lower price point. This one's going to be about $11 on average per person. Now, a couple agent support tools that we have available for you. First off, it's our website. Well, first off, I should say, is our producer portal. From producer portal, you can log in. You can access information on your existing clients, commission details, any and all of those things that you expect from a portal. But we also have a really valuable agent marketing site. In fact, the agent marketing site has 4 different tabs up top. But one is just kind of for you, maybe, kind of the guts of the product, if you will, the specifics, pricing, stuff like that you can really kind of like dig into. Different training videos, topics. Then there's a share with client button. And I think this one's really valuable, and a lot of people tell us so. But in there, you can grab some of those materials. You can personalize and print for clients. But we also have some really valuable social media pieces. And this is where I think if you're not doing dental and vision, just try it. go out there and grab a couple. They're pre-approved. And just like this one here, you can see it says 4 tips for purchasing individual dental insurance. You can create it for Facebook, LinkedIn, Twitter. There's different mediums you can post it on, but just drop it out there. I think we hear it all the time, but with dental, it's one of the biggest things. Just let your clients know you offer dental and vision products, and you will be surprised how many reach back out to you with the need for it if they're not already. So if you're not great on social media, if you're looking for fresh new content, or if you just want to let clients know that you offer dental and vision, go out there, grab some of those pieces, drop them out there on social media, and just begin to market. Let them know it's available. Reach out to, again, those new clients just to put your foot in the door and see what comes about. I think you're going to be impressed. I think you'll be shocked. We do hear this often. And again, a lot of different pieces like that to support you. Also included there some pre-approach letters that we have that you can mail out to your existing client base. And all this is tied to, I think, the ease of enrollment that we offer and have for you at Ameritas. You can even include your own link that clients can access, see product, quotes, and also enroll themselves from your site. Now, topping off some different support tools, of course, myself, reach out if you have questions, but we have a Sales Connect team there for any marketing related questions, in-force questions they can try and assist with, whatever it is, whatever you might need. And that does also now include bilingual services for any of your Spanish-speaking clients. Now, here's a look at that quote and enrollment process. So if you have not already, I really do encourage this, and I know nobody just wants to do this for fun. Adding another carrier, I get that, right? But reach out to URL and just get appointed with Ameritas for the dental and vision. Just have it available, right? It's another product that you can turn to make available to your clients when they ask for it. And you can also drop it out there and just kind of pick up that interest that I assure you already exists. Because when you appoint, we're going to send you a welcome email. Included in that welcome email is going to be a link. It's your shopping URL. And it's personal to you. You can share it. You can post it on your website. You can include it in your email signatures, or even just like I did here, different ways you can get creative with it. Create a QR code. Now, I'm not real great on technology, but I did learn how easy it is to create QR codes. This one I did for free, and it's probably why it has a little dinosaur here in the middle. But if you take a picture of that, and I think everyone's getting much, much more familiar once again, right, with QR codes. We see them everywhere. But if you snap a picture of that, you land right on my quote and enrollment site. Now, I just use that for example purposes, but that's what yours would look like, and that's what you can do with it. People have told us, right? They'll go out and visit some of their network providers, some of their dentists, and say, hey, do you mind if I leave some material here for clients that might be interested in dental insurance? Include a QR code to it. Let clients pop it open, quote, enroll while they sit in a dental office or other places. Wherever you think it might be valuable to offer it as both an opportunity to quote enroll for coverage. Here's one example. I took that rated best for dental for seniors 2023 and made a QR code out of it, dropped contact information underneath it. You can make business cards out of this thing. You can make a postcard out of it, stick it in some mailboxes, wherever it might be beneficial. But again, the benefits of it, your contact information, and the ability to jump right into your site to both quote and enroll clients for coverage. So that's how easy it really can be. Just put it out there and make it available. As you do, you can talk to your clients with this product. You can sell it virtually. You can sell it over the phone. You can sell it through a Zoom. You can even sell it to them on your phone. We have the ability to quote and enroll right from a mobile phone. So all those different website accessibility features. But I will say this, the first thing you want to do is always go to the top right-hand corner. Oh, by the way, I'm sorry. This is what your site is going to look like. So this is kind of not necessarily a live look, but a current look at the quote and enrollment page. The family playing soccer, an agent button in the top right-hand corner. Click on that. It's going to have your contact information, your name, your phone number, and email address as we have it. So you're on your site. Anything done from here, you're getting credit for. Next step, just go ahead and drop in a zip code. Right there, you see it. Zip code drives everything. And I think that is also another great thing about this site. You never have to wonder, oh gosh, which product's available, or oh, is there a state-specific version, which some do exist, but it's only going to pull the specific product and pricing based upon the zip code that you've entered. That's it. That's all there is to it. We're zip code based. There's no age, gender, anything like that. Strictly zip code based in our pricing. So as you put in the zip code, pulls the available product and the specific price for that area. So next up, it's going to ask you about, do you want dental? Do you want vision? And how many people need coverage? We can do, remember, just dental, we can do just vision, and then you can bundle this up for families. Once you get to 3 or more, the price point doesn't change. So advantage, big families, right? I do me and say a dependent. That's a price essentially for 2, me, 2 dependents, price for 3 of us. And again, once I get to that 4, 5, 6, price doesn't change. So keep that in mind for any families out there. But the pricing you're looking at here is individual. And this is based on the zip code that I dropped in, more specific to my area. And you can see here that that value plan we talked about, just kind of that less expensive plan, basic coverage, $17.91, $38.62 for that access, which included the ortho as a reminder, and then $46.19 for that richer benefit and the one that included the hearing. So a little bit of look at each of those, the specific pricing, other things that you can do here. You can share the plan. Like, hey, we didn't get a chance to talk about it today, but I know you had interest in dental. Let me send something over to you. Right from your site, you can share, put in your client's email address, send it off to them. Your link arrives to them that they can, again, check it out when it's good and a good time for them. You can stack up and compare plans side by side. You can select a plan and begin your checkout process. So I like this one here. I'm ready to go. Before I do, I probably want to know if my provider's in network, right? Always a really common question. So you can see there that there's a find a provider button. If I click on that, it's going to pop me open to this page. And the find a provider should probably already populate with the zip code that you've put in. Now, you can dial down into more specific address and whatever it is you want. You can even open up this filter and go like a deeper dive. Like I'll hear this sometimes, right? Like, hey, it's great. You've got 131,000 providers, but do you have mine? Well, open it up. You can search for a specific dentist by name or practice, whatever it might be. In this case, we're just going to do a random search based on the zip code, and up pops a pretty complete list of providers. I think this one here, I can't quite make it up, but you know, it might show a couple hundred on one page as you scroll up and down it. So important thing to note here, anyone on this page is considered in-network. That's it. So if you see them here, they are an Ameritas network provider. And what does that mean? More savings, right? 25 up to 50%. Anyone that's in network has agreed to at least a minimum of 25% discount on services up to 50. And that's sometimes why you might see someone here in green. Just as we have Sammy up in the top left-hand corner, you can see he's in green. Well, we can't specifically disclose the discounts that providers offer. There's some contractual, I think, limitation there on what we can break down, but we can tell you when someone is offering a deeper discount than others. And if they're in green, that's kind of the heads up for it. So Sammy is probably offering deeper discounts than others. If your client goes to this dentist, great. If your client's looking for a new dentist and wants to save more money, maybe that's the one, but just our way to kind of identify that. So important thing though, anyone on the page is considered in network. Now, As I go back and I select that plan and I begin my checkout process, this is the first page that pops up. So again, I just find the Enroll Now button, and it drops me right into this where it asks for a coverage start date. Coverage start date can be as soon as tomorrow. And I've really hit on that point, right? Like, hey, enroll today for coverage that can start as soon as tomorrow. And in fact, that's probably when most clients want it. You know, they purchase dental with the intention of using. We see that often, but whatever's flexible and best for your client. You can enroll today and you can push it out as much as 90 days. It is your choice. We do any day effective dates. You don't have to wait for the first of the month. Do it, choose it whenever you want. But when you choose it, that will be the first date of billing. So if I elect, let's say June 25th, great, coverage starts June 25th, I'm going to be billed June 25th. So keep that in mind for your clients. You can always change the billing and date and everything else if you want it, but coverage start date 1 to 90 days out. We do ask for a client email address if they want to provide it. And the reason we want to try and give them access to a client portal, they can access temporary ID cards. And now we even provide temporary ID cards at policy issue. So clients will have those right as they're ready to go. Now, next step, you're going to enter in the applicant information. These are all the steps right here. You can see them quick and easy. Applicant information, we ask for name, address, date of birth. We do not and will not ask for a social security number. Good for a couple of reasons. But we ask for that basic information from your client and any necessary dependents. And then you're into the previous insurance. This is where you're going to enter in that credit for prior coverage. That's step 3. So once you get in there, if a client is looking to kind of qualify for it, give us the current carrier name, termination date, if any, and the policy number. That's all we need. There's nothing else to send in. Your client has then qualified for the credit for prior coverage and will immediately jump to those year 2 coinsurance levels. Easy. So really nice benefit to take advantage of there, and a real simple process for it. You'll review everything, or your client will review everything if they're doing it independently through your site. Provide payment information. This can be checking, savings, or a debit card, anything like that. Credit card, multiple ways to pay. And then you just click on the agreements. There's nothing to sign. Client authorizes. With that, policy is approved and you're ready to go. They get the ID cards. We'll have those mailed out if they want them, and you're complete. The other thing really neat about it, I mentioned it, you can provide this link to your clients. Since it is tied to your site, if a client does choose to enroll, you get notification of it as well. So client gets a notification with those temporary ID cards. Hey, you're enrolled for coverage, and you get an email as the agent of record that a client just enrolled. And that really does take place. It's a really good thing. You send a link to your client. You're sitting at home Sunday afternoon watching a game, and you get notice that they enrolled for dental insurance. So biggest thing, just take advantage of that. Get appointed with URL just to have this available. Make it available for your clients, and see the kind of response that I'm confident it'll generate for you. Really good product, really good benefits, one of the nation's largest networks, and I think a really easy, simple enrollment process. So with that, Deb, I'll turn it back over to you for anything I missed or questions that we've got.
Nothing that you missed. I think that the product speaks for itself, both in the dental and the vision. We do have some questions, though, that I think actually are really good questions. Jay is asking, what prevents a client without a waiting period from canceling coverage as soon as service has been rendered? Are there chargebacks on commission if this type of cancellation occurs?
Good, great question. And I wish there was probably a better way to keep it from happening. There isn't. A client can enroll for coverage and cancel at any time. There is no contractual period, anything like that. But we do kind of pay an as earned commission. So we're only paying commission as premium is being collected. So in this instance, I guess there's not a chargeback unless you're being advanced on it. But pretty straightforward, simple process. As a client pays premium, you're being paid commission. No window for a client, and nothing to prevent them other than, hey, please don't canceling coverage after they use it.
Right. Kristen is asking, is there a turnaround time for verifying the previous coverage? Another great question.
That is a great question. And there is not. No, it's immediate. Once you enter in that information, we don't really have a, I hope it's okay to say it this way. I mean, an authentication process. You know, we process a lot of dental apps every day. It's on our system, right? If you give us that information, we're assuming it's qualified coverage, and they automatically jump into that co-insurance. So there's nothing else that's needed or qualifies them for the CPC. Just everything that you're going to enter in and provide to us on the site.
Excellent. That seems to be all the questions. There are no new ones that came in. Just as a reminder, everyone will get the recording and the link, the slide deck, what else? Contracting link as well. And if you do want to get appointed prior to getting this follow-up, just shoot me an email, debw@urlinsgroup.com, and I'm happy to start that process for you. Additionally, if all of you on this webinar, I see that most of you are in the Medicare markets. If you've not yet registered for our Medicare Connections Conference, which is our 10-year anniversary, that is being held August 24th. So please go ahead and register for that, excuse me, if you haven't already done so, again, at the Hershey Lodge and Convention Center. So we'll be following up. Chad will be following up as well. And, you know, to everyone that took time out of their busy morning to join in, I really appreciate it. Chad, I truly appreciate the presentation. Great product. And I know we here at URL are looking forward to marketing it.
Well, great. Well, I'll just say that too, Deb. Thank you. And thanks to everyone that did join in. I really do appreciate it. I look forward to your questions or, again, whatever I can try and do for you. So thank you.
Thank you. So we'll sign off. Enjoy your day.